Cavaliers. They are adorable and very popular, but also very frequent visitors to the vet clinic that I work at, often for fairly predictable problems. So if you want to add a Cavalier to your life, or if you already have one, or 3, or you're just curious, I'm going to talk about the most common health concerns that I see in the Cavalier King Charles Spaniel. My name is Dr. Ferox and I'm a general practice vet, which means I'm the sort of vet you come to see when you first have a problem. I'm not a referral vet or a specialist vet. I see these dogs every day. And firstly, I would like to thank my very generous blog followers who have inundated me with videos and photos of their own Cavaliers for this video. And I need to specify that I'm not bagging out Cavaliers in particular. All breeds will have health problems. Some are healthier than others and none are perfect. And just because a problem is very common in a breed, it does not guarantee that an individual will or won't get it. It's more a matter of deciding what problems you are willing and able to manage in your furry companion and being aware of them so that you can manage them when they first show up and not further down the track when they become more complicated. So first and most obviously, we have mitral valve disease, which is a type of heart failure. Normal blood flow flows in one direction through the heart. It comes in from the lungs to the left atrium, crosses the mitral valve, into the left ventricle, and then across the aortic valve onto the rest of the body. But Cavaliers develop myxomatous changes to their mitral valve, which means they become thick and lumpy and then they leak. That means every heartbeat's less efficient and the blood flow is more turbulent, so we will actually hear that as a heart murmur. This will increase the blood pressure within the heart, particularly the left atrium. The heart itself will eventually enlarge. You get pulmonary edema, which is fluid in the lungs, and sometimes they'll even break a heartstring, which is called a ruptured chordae tendineae, which is very dramatic when it happens because now that valve is flopping every which direction. Instead of just a little leak, it's total chaos. Usually these dogs get managed medically, and I prefer to start them all on pymabendin fairly early because there was one study that suggested doing so extended their lifespan for about 30%, which is a pretty big difference. All breeds can get mitral valve disease, but the Cavalier tends to get it much, much younger than a typical breed. I think the youngest I've seen was about 5, but nowadays 8 or 9 years old would be more common. But in other breeds, that's going to be more like 12 or 14. Breeders can screen for mitral valve disease, but only early onset, because if you're screening a 7-year-old dog, you've probably already bred that dog. So they do have a challenge trying to get rid of this, and any improvement is a good improvement. So try and pick a breeder who is screening their dogs. Next up, we have dental disease, because almost all Cavaliers will have some sort of dental disease, and it is often not covered by pet insurance, so check the fine print. Cavies are generally considered to be brachycephalic, and instead of their teeth sitting nicely one after the other in a fairly straight line, a lot of them will have premolars that are actually rotated at 90 degrees, causing abnormal pockets where food and calculus gets trapped. Now, even if you're very diligent and you can brush your Cavie's teeth every day, you can still end up with trouble here because you can't really get them to floss. And once those teeth start to go, they're probably better off out, because if you have persistent infection in the gums because of the teeth, that does predispose to things like osteomyelitis, but also things like kidney failure and, interestingly, heart disease. Now, with those gorgeous looking ears, you do have to expect they will be prone to ear infections. Those ears are big and heavy and they trap humidity super easily. So anytime you get water near them, you're running the risk of a yeast infection. Admittedly, sometimes reoccurring yeast infections can be a sign of a food allergy, but this breed has a distinct anatomical predisposition. Ear infections of any sort are much easier to treat early than if you sit on it for a couple of weeks. Neck pain and back pain in Cavaliers is also pretty common. Sometimes the dog just did itself a mischief jumping off the couch, and sometimes it's more serious than that. They can get intervertebral disc disease, which if it's a low-grade one will just present as pain, but a high-grade one will need fancy specialist surgery. And neck pain could be muscle, but it could also be syringomyelia, and without an MRI, you don't know for sure. Usually we put them onto pain relief, and if they do well, we keep going, but we only pursue something like an MRI if they're not doing well, because an MRI around here is about $2,000, and not everybody has that. Now, chiari-like malformation and syringomyelia are big topics for Cavalier health. In chiari-like malformation, the skull is too small for the brain. So this causes part of the brain, the cerebellum, to squish into the opening of the spinal canal where the spinal cord should be. And this causes a fluid buildup in the brain and spinal cord, which is syringomyelia. While all cavies have chiari-like malformation until proven otherwise, they won't all have syringomyelia, and the degree of symptoms will vary. Now, you need to go through an MRI to definitively diagnose this, and a lot of cavies won't because it is very expensive to do. So we often make assumptions based on their symptoms. And those symptoms can include neck or back pain with a twisting body to one side, or ear scratching, which is the hard one because ear infections also cause ear scratching. And a lot of these dogs will also have an ear infection, so that is a more challenging symptom to work with. Fluid in the brain can also present as hydrocephalus, and interestingly, I have seen 2 Cavaliers with hydrocephalus. It is a very rare condition in general, so it is a little bit suspicious that 2 dogs of the same breed came up with a very rare condition. And chiari-like malformation is reported to be able to cause seizures, so I do wonder how many cavies with idiopathic epilepsy but did not have an MRI actually have some degree of syringomyelia. It might also be masked because we treat a lot of these dogs that present with just pain with pain relief, and for a mild case, that's fine, that improves their quality of life. But you can also reduce the symptoms with drugs like furosemide, which is used very commonly for dogs with heart failure, and Cavaliers very commonly have heart failure. So we are possibly masking the symptoms, which from a research perspective is not very convenient, but the bottom line is if they're making the dogs comfortable, that'll do. Speaking of furosemide, Cavaliers are also prone to kidney failure if they live long enough. I'm unsure if there's a true genetic reason or if it's a result of many of them being on anti-inflammatory medication and furosemide for a long time, both of which have potential side effects affecting the kidney. Severe dental disease will also predispose dogs to kidney failure, and cavies are prone to that as well. Now, Cavaliers are generally considered to be brachycephalic, meaning that their nose and their skull is shorter than average. This can result in long, soft palates, and you will hear a lot of these dogs snore. But they can also have stenotic nares where the nostrils are quite squished shut and don't open properly, as well as being associated with chiari-like malformation and those rotated premolar teeth I mentioned before. They're not as severe as something like the pug, but they are still potentially a problem, and it can predispose them in particular to heat sensitivity, which as a vet working in Australia is a pretty significant concern for me. So on the orthopaedic side, I still see a fair few of these dogs for medial patellar luxation, which is when the kneecap pops out onto the inside of the knee. Some of these dogs benefit from surgery, but if they're a very mild one, sometimes we just manage them conservatively. And as long as you don't let the dog get so fat it turns into a little watermelon with legs, a low-grade one does okay. They are also reported to be more prone to hip dysplasia, but being a smaller breed, I have not seen as many clinical problems with hip dysplasia, not like you would in a German Shepherd, for example. And it's possible that some dogs with back pain also have hip pain, but because they're being managed on pain relief anyway, it doesn't become an issue. So breeding for cute little faces often means breeding for quite big eyes, and that often results in exposure keratopathy, where the eyes are so big that the eyelids don't quite close properly, resulting in the cornea drying out and being very prone to damage. They're also prone to a few genetic eye problems, including corneal dystrophy, where the front of the eye is built wrong. I've seen a lot of it lately with lipid deposits in it. They can also get retinal dysplasia, where the light-sensitive cells at the back of the eye are kind of built wrong, and this affects vision. Retinal atrophy, where the light-sensitive cells were built just fine, but they're degrading way too fast. And cataracts, where the lens goes really solid and hard and opaque. And you can actually get surgery done for this one. It's about $5,000 per eye. Hopefully breeders are getting eye certificates from ophthalmologists before breeding their dog to screen for multiple conditions. Hopefully. Related to the eyes, cavies are quite prone to getting warty skin growths, and while most of them on the skin will be benign, still get them checked as they show up, but most of them are fine, and I often leave them alone if they're quite small. If you get one on an eyelid, they are probably worth worrying about, because if they grow quickly, they can physically damage the eye, which is often a little bit delicate at the best of times in a Cavalier. And if it grows too big, you really make a mess of the eye trying to remove a large lump. It is so much easier to remove a small lump. And I'd much rather do surgery in a young Cavalier who has not got a heart murmur than wait until they're 10 and definitely have a heart murmur. Cavaliers are reported to be more prone to diabetes than average. And I think it's probably true, but not by a whole lot. I think partly the reason I see so many diabetics is because I see so many Cavaliers. I certainly see more diabetic cavoodles than I do purebred Cavaliers. But they are prone to pancreatitis because they are lap dogs that don't exercise much, so they get quite chunky. And they're adorable, so they get fed lots of human food. And when that happens, they're more prone to getting pancreatitis. And if you get pancreatitis quite often, the pancreas heals with scar tissue, and that can predispose you to getting diabetes. So I don't know if it's a true genetic risk or if it's just a lifestyle risk. The breed is also reported to be more prone to bladder stones. However, I haven't clinically seen this as a problem. It might be because a lot of my Cavalier patients are being fed food that is protective against struvite crystals anyway, but it is reported to be a problem. Certainly if you get a dog with reoccurring UTIs, it would be worth checking out. I do, however, see plenty of Cavaliers with anal gland impaction and anal gland infection. And generally, the smaller the dog, the more prone they are to problems. Some of them can be managed by just changing the fibre in their diet. Most of them need more fibre. Occasionally they need less fibre. And some of them just come in every now and then to get their butt squeezed and express their anal glands manually. You can also learn to express anal glands at home if you're feeling super keen, but most of my clients prefer to pay someone to do it. Allergies and atopy are super common in general, but they are also common in the Cavaliers. Most of them are allergic to some sort of grass, but food allergies do pop up as well. And allergies can predispose to reoccurring yeast infections. So if those ear infections are not clearing up well, it might be worth investigating the possibility of an underlying allergy. And lastly, an interesting one, particularly for vet students watching, some Cavaliers will have macrothrombocytopenia, also known as idiopathic asymptomatic thrombocytopenia, which you will probably discover when you are doing a pre-anaesthetic blood screen on a dog you thought was healthy just to make doubly sure, and there's no platelets showing up. They look like an immune-mediated thrombocytopenia, but the dogs have no clinical signs. And that's because these dogs are actually fine. For some reason, apparently to just keep vets on their toes, some Cavaliers will have much fewer platelets than normal, but their platelets are extra large. So if you send that blood off and get a pathologist to look at it, they'll give it the all clear. But if you run it through your machine, or if you're not sure what you're looking at, it will look like there's no platelets there because the machines don't read them that way. These dogs are clinically fine. It's still worth checking that that is actually what you're dealing with because they'll have it the rest of their life. And that way you won't panic every time you do a blood test on them. Cavaliers are delightful little dogs. And once you've had one, because of their charming personality, you will probably always want one. They do tend to be addictive. But you do know what you're in for. So I would consider whether pet insurance is right for you. And if you can, try to choose breeders that are doing the health screening. My name is Dr. Ferox. Thank you so much for watching this video. I hope you have enjoyed all the clips that my blog readers have sent in of their own pets. And I will see you next time.